Hello, I'm Kyoung. Thank you for inviting me. This study focused on whether histogram values of normalized apparent diffusion coefficient and normalized cerebral blood volume maps obtained in contrast-enhancing lesions detected on immediate post-operative MRI imaging can be used to predict the patient's response to concurrent chemoradiotherapy with temozolomide. Glioblastoma is the most common primary brain tumor, representing between 12 to 15% of all intracranial neoplasm and 60 to 75% of astrocytomas. The current standard treatment for GBM is maximum safe tumor resection followed by concurrent chemoradiotherapy with temozolomide and adjuvant TMG. Immediate post-operative imaging is used for determination of residual tumor and detection of surgical complications. However, the enhancement pattern itself is known to have limitations in differentiating residual tumors from enhancement caused by post-operative changes. Thus, these contrast enhancements are commonly recommended to be evaluated by advanced MR imaging. Advanced MR imaging, including dynamic susceptibility contrast-enhanced MRI and diffusion-weighted imaging, have been studied for GBM in many previous studies. Several studies revealed that MR perfusion and diffusion imaging is sensitive for tumor grade, prediction of survival, and distinguish treatment response from disease progression. However, there have been no reports regarding its application for the prediction of response to CCRT using DSC and DWI on post-op MRI imaging. The purpose of this study is to determine whether histogram analysis of normalized apparent diffusion coefficient and normalized cerebral blood volume maps of enhancing lesions detected by immediate post-operative MRI imaging could predict the response to CCRT with TMG. From 2009 to 2012, 24 patients with glioblastoma who showed measurable contrast enhancement on immediate post-operative MRI were enrolled in our study. Among those, 11 showed progression, while 13 shows complete response or stable status after 2 to 6 cycles of adjuvant TMG, according to Lano criteria. Clinical characteristics of each patient, including age, sex, KPS, methylation status of MGMT promoter of the tumor, and radiation dose of CCRT, were gathered from all patients. 66 patients with GBM who had undergone surgical resection at our institution were selected from this study. The inclusion criteria were as follows. We excluded 42 patients due to the following conditions. The immediate post-op MR imaging studies were performed using 1.5 Tesla or 3 Tesla scanners and used imaging sequences like these. Post-processing was obtained by using dedicated software package Nov-Dec ICE. ROIs were measured and contained the entire enhancing regions. Areas of necrosis, hemorrhage, or non-tumor macrovessels were excluded from the ROIs. Finally, mean NCBB, mean NADC, histogram parameters from NCBB and NADC maps were obtained. ADC value were defined as ADC value of the book cell divided by the ADC value of normal cerebral white matter. None of the patient clinical characteristics, including age, sex, KPS, MGMT promoter status, and radiation dose, were significant predictor of progression or non-progression. Among perfusion and ADC parameters, the C99 of the cumulative NCBB histograms on immediate post-operative MR imaging was significantly higher in the progression group than in non-progression group. However, we could not find significant differences of mean NCBB and other histogram values from NADC maps between two groups. ROC analysis of NCBBC99 showed that the best cutoff value was 5.537 for the prediction of progression after CCRT, and sensitivity and specificity was 72.7 and 76.9%. These are MR images of progression patient. Immediate post-op MR shows diffuse enhancement at posterior aspect of the tumorectomy site with increased perfusion and decreased ADC value. After CCRT, the lesion showed progression. The NCBBC99 of the ROI was 12.9. These are MR images of non-progression patient. Immediate post-op MR shows diffuse enhancement at posterior inferior aspect of tumorectomy site without significant increased perfusion. After CCRT, the enhancement was completely disappeared. The NCBBC99 of the ROI was 3.6. Survival analysis showed significant differences in progression-free survival of dichotomized patients group by C99 for immediate post-op MRI, when the cutoff value was 5.537. The significantly better outcome was noted in the group with NCBBC99 less than the cutoff value. In conclusion, the NCBBC99 of the cumulative histogram analysis of NCBB from immediate post-operative MR imaging may be feasible for predicting GBM response to CCRT with TMG. Thank you for your attention.